And there's always going to be a learning curve, but to be able to get your team members on board, explain why you're doing it, why you think it is a good idea, how it can benefit not just you as the vet, but them as the support staff, how helpful it's going to be for them and make their lives easier or better. And that's a good way to get your team on board.
Hi everyone, welcome to the Vet Reset. I'm Dr. Sandra Siegal.
And I'm Dr. Whitney Terrell.
What are we going to be talking about today, Dr. Terrell?
So I think today we are going to be talking about ways to improve our practice. So if your practice is hitting a slump, what are some ways that we can address that and make that better? Things such as client interaction and communication, utilizing our veterinary technicians, and just optimizing practice operations and client experience.
Fantastic. I'm ready to dive in because this is a topic near and dear to my heart too.
Same.
So I'm all about this. So I'm excited that we'll be able to be talking about transforming a practice.
Yes.
And hitting that reset maybe on some of the things that we've been doing historically and need to kind of have a little reset on. So some of the things I'd like to talk about are professional first impressions, which I know you're very passionate about too.
Yeah. Mm-hmm.
We'll talk about some effective communication tools, utilizing technology. This is another big one I think we're both very passionate about, talking about technology tools that we can utilize in the practice. And then also tools that can really help the engagement with your clients too.
Yeah, absolutely.
So let's dive into the professional first impressions. What I always am all about is personal branding. Mm-hmm. So yes. I think, and I'll ask you this question because I'm curious. How do you feel about how you kind of dress or how you present yourself to clients? This is like a big question.
It is. It's a big question. And there's actually been studies in the veterinary world. I know Dr. Mariah Mulkey had brought it up on one of her podcasts, and I think she had dove into the study. But it's if our patients who are not human, if they react differently to having someone in scrubs and a white coat or just scrubs or more casual wear, and then how the clients also feel to that. Funny enough, it seems like the patients and the clients are more comfortable with just wearing scrubs alone. Mm-hmm. And that's what I have started doing. When I worked in mixed practice, I was more brand t-shirt or company t-shirt and jeans and boots. Initially started out doing a little bit more professional wear. And then now I'm scrubs. I mean, scrubs are practical. We get peed on, we get pooped on. You've got to have your pins. You got to have, And so I think scrubs are the way to go. All in all, it doesn't necessarily really matter as long as you feel good, you can move, you can do whatever you're needing to do for that day, whether it's in, clinical practice or teaching, whatever.
Yep.
Yeah,
I definitely
what about you?
I definitely think it's a personal choice, of course, but I do think there is some interesting points about branding as a clinic, that you are presented as a team. So whether it's, being in similar, whether the scrubs look similar or maybe you have a color for a day or something like that, I think that can be effective.
Yeah.
But I definitely think that, looking professional in the room is really important as you're seeing client. Obviously, if you're a large animal vet, there's practicalities to that. So it's a different story. But I think that having that presence in front of clients is really important. I had a friend and colleague who looked very young, and she'd always be like, every time I walk in the room, someone says, am I too young to be a vet, or I can't possibly be a vet because I look
or
too
you're
young.
The tech or the assistant or something like that.
Yeah, so it's and I know she was always frustrated with that, and
it's hard, and I think it's hard starting out too, because you're going to run into that, especially if you have a baby face or a lot of times if you're a girl. But I will say that being professional, this is something I feel very passionate about. Being professional does not have to equal boring. And so oftentimes I do wear scrubs, but I also have a lot of printed shirts. I have shirts that say, "Tell your dog I said hi." I have shirts that have just tons of different dog faces. And I think one of the things that clients like about me is that's a way to show my personality. And, you can be professional, and I'm going to, be professional and, talk with respect and go through things. Obviously, I went to school, so I have my information and my knowledge there, but to show that personality, because I've had people that go in and like, man, I know this person outside of work or the veterinary practice. But then when I go to see them as my dog's vet, then it's so business and straightforward and stuff. And to me, what you see is what you get. I'm the same in practice. I'm the same outside of practice. Maybe a little bit more cleaner while I'm in work scenario. But yeah, professional does not have to equal boring.
I agree.
But it can be practical. So
yeah. I agree with that. I definitely, when I was in practice, I definitely did the white coat and all of that and scrubs underneath. I think, according to the AVMA, they've reported a positive first impression can significantly impact client satisfaction. Totally makes sense, right?
Yeah.
I think also it's important to, I'm going to say something really unpopular probably, but we have to, as vets, we sell. We sell ourselves, we sell our treatment plans, and I'm using sell in terms of having clients come on board with what you're recommending. Like it's sort of like selling yourself, it's selling your clinic, it's selling, the treatment plan that you're wanting them to take.
Absolutely. Well, and unfortunately, we're having to battle Dr. Google and social media experts that are not veterinarians, that are not in the veterinary community. So why should they trust us over, someone they're seeing online? So I think that's a really good point. And I know I have a friend on social media that his name's Dr. Josh, and he really talks about clinical empathy and how important it is to just listen to your clients as well. So obviously you want to be, introduced and go forward, make eye contact, shake hands if, that's your thing. And, some people don't want to touch. So, just kind of keep that in mind. But just really being open and listening to your client is huge in itself.
I agree with that. Yeah. One of the things too, let's talk about something you and I touched on off camera. But how do you introduce yourself to your clients? How do you have people address you in the clinic? I think this is a fascinating kind of topic. It is.
It's a really good topic, and everybody's a little different. So I am Dr. Terrell to my clients and pretty much to the staff as well. Now, we become close and stuff as a staff. So whenever clients aren't around, some of them may call me by my first name, but typically I want to be addressed by my title. I worked hard for that title, and I want to show that, this is me. I'm Dr. Terrell. I'm a doctor in veterinary medicine.
Yep.
I'm proud of it. I worked hard for it, paid a lot of money for it. So I would like that respect that we give other maybe human physicians out there. And sometimes we see that there is a difference between even male and female vets. I've noticed one of the reasons why I don't go by Dr. Whitney is because a lot of times people would just drop the doctor and just call you by your first name. And whereas the male counterparts that I've encountered, it's always doctor first name or doctor last name. And rarely do they call them by their first name. I don't know if it's because as females, we maybe seem to be more empathetic or personal, so they feel more more comfortable with us if that's why. But for me, it's just a respect of my learning and my knowledge, and that's why I always like to do it. Now, staff and stuff, again, it's mainly for in front of clients that I prefer to be called Dr. Terrell. I don't mind if they call me Whitney and stuff when we're not in front of people. Yeah. But it's just a kind of a respect thing.
Yeah, I agree with that. I think that's part of the personal branding too. That's important, and having that consistency. And so I think that's something though to talk about and be open about, because it's having experience with different situations with that, and but it's considering all of the aspects of your hospital. I think important of how is your branding coming across, and are you guys working together really well and coming across as being a team, and what are the things around that you may be like, oh well, it's just a color scrub or someone's walking into a room that's and they're dirty, like how that comes across. And I know we're working at a million miles an hour, but it's looking out for each other for that. Yeah. Because
and what I hate is whenever you go into a room, it's always these two different things. You either go into a room and you think that you've met the client before, and so you don't introduce yourself, and you're just like, hey, how's it going? Blah, blah, blah. And, you get your stuff, you do your exam, and then later you look and you're like, oh, I'm so sorry. I've never met you before. I'm Dr. Terrell. And I hate that. Or the reverse is, and I think is maybe worse, whenever you come in and you're like, hey, I'm Dr. Terrell. Nice to meet you. I've been here 3 times. You're like, sorry, forgot you.
Well, I would always remember the dogs' names, but I just always have trouble with that.
Yes, it's so much easier because that's who you're focused on primarily.
Right.
So.
Like Joey.
Yeah.
You're like, oh yeah, the person that comes with it.
Yes.
Well, let's talk about effective communication tools. And this is very interesting too, especially in the last several years. We've had an influx of new opportunities with digital tools, technology tools that can really make significant efficiencies in the practice. So according to Veterinary Economics, digital communication tools can improve client retention and satisfaction by up to 30%. I'd even say that probably could even be more this time. And it just depends on the types of tools that you incorporate into your practice. But let's talk about a little bit of those technology tools that can be used.
Absolutely. There's so many different options out there now that not only make our lives easier as veterinarians or business owners, but also the clients. So it can be scheduling online. That's going to free up your receptionists where they're not on the phone, answering phone calls all the time just to schedule. They can go ahead and do that themselves. Two-way texting, which we've talked about, kind of triaging for telecommunication. So one of my favorite things is AI scribes. I am a big I want my notes to be good and thorough, not only for legal reasons, but also to help me and to potentially help either my partner in my practice, or if I'm referring my patient, to let them know that, okay, these are my findings, this is what I recommended, and so on and so forth. And I know, oh yeah, we had that conversation, or I didn't make this recommendation, I need to go back. AI scribes have been so good, and I've, have one that I use. You can private message me or DM me if you want to get more details on that. But it has saved so much time for me to be able to press record, go in, and the biggest difference is just having to verbalize everything, verbalize your findings and whatnot. And it's been huge. It types up your stuff in a SOAP format. You can even edit how you want your notes on the platform. And it's super helpful. It saves me so much time. I'm not having to stay late to work on my notes anymore. And then it's good for my clients because it's so much more thorough. I know what we've discussed. I can do handouts from it. I also utilize veterinary partner online for any type of informational packets about medial patelloluxation or allergies to give clients. So there's so many different things that we can use to help not only ourselves but also our clients.
Yeah, I think it's important to maximize our team members that are in the practice. So our valuable vet techs, our reception staff, like there are tools that can help their job that frees them up to do all the things that they're supposed to be doing every day, and want to do, and not get bogged down by, a ton of phone calls. I just remember the phone ringing all the time, and it's like really distracting and kind of upsetting, it's just like, and you're concerned about that person, getting pulled away. And I think also on the, I remember the days of like staying till 10 p.m. doing notes at the end of the day. And you don't want to leave them to the end, but
you don't want to save them for the next day, because then you're going to forget that really important information.
So you have to get that all done. And and we all know how critical that having notes, it's just really important to have that all together. But I think also clinics may be hesitant to start new technology in their practices. They probably feel like it's something that's really going to disrupt everything if I get something brought in, and
it can, but in a good way.
Yeah, and it's the investment of that, and I don't think it's probably as bad or intense as people think it would be to get something incorporated. It's like a shift in the workflow, but like you said, it's a good investment, and it's for a good reason.
Absolutely.
So it's that investment of the time of doing that and getting everyone trained on it.
Yeah. And there's always going to be a learning curve, but to be able to get your team members on board, explain why you're doing it, why you think it is a good idea, how it can benefit not just you as the vet, but them as the support staff, how helpful it's going to be for them and make their lives easier or better. And that's really good and a good way to get your team on board with that.
Yeah. And help with burnout at the end of the day.
Yeah, absolutely. So keeping everybody happy.
Yes. And sane. Yeah. So you touched a little bit on the educational tools for clients. So I think that's important too, as we battle Dr. Google. Also making sure that I think when clients are in the room and say there's something, kind of emotional, they're hearing a diagnosis or something like that, and you're giving them a ton of information, they may not always be in the greatest frame of mind to be absorbing all of that. So some of the tools to use sort of after that conversation, I think is important, is of sending those things, whether it's through two-way texting or through email automation, that they get information that's relevant to them.
I 100% agree that I know when either me or my children are at the doctor's office and they're giving us lots of information, I can think about so many different questions, but you're thinking about 500 different things. And then whenever you come back to that follow-up appointment, you don't know what you were going to ask. You've forgotten it all. And I know how I've recently had a patient that came in for something completely different, came in for having issues kind of getting up and down. It's getting an old dog, and did a full physical exam, because you should always be doing a full physical exam on your patients, and unfortunately found several elevated lymph nodes. With that, made recommendations to do an aspirate and send that cytology off, and unfortunately it came back as lymphoma. And that we were able to do that all within like 1.5 days. I feel like 2 days. And we had a diagnosis for that owner who came in because her dog was having trouble getting up. And then I'm having to give a cancer diagnosis that she was not expecting. And the dog seemed happy. And that was heartbreaking for all of us involved. And I knew how it is and when I'm in scenarios like that, for me or my kids, you're going to have so many different things going through your mind. You're not focusing, you're not hearing really everything. So that's when I started. I mean, I've done it in the past, but that's when I printed out stuff about this medication, this cancer, gave it to her. I said, I know this is a lot. You've been given a lot of information. Go home whenever you can, read this and think of questions, write them down. Whenever you can, give me a call back or send me an email, and I'd be happy to answer them. And I think that using tools like that, because depending on the practice, you're going to have 15 to 30 minutes typically with a client. That's how your appointments are scheduled. So you might not have time to go through the mechanisms and pathways of Cushing's disease.
Right.
So like being able to give clients that breakdown that's so wordy that you can't really get to is so helpful, saves you time in having to do that. And then if they have questions about it, or, hey, I read this, is this like fluffies? And, it keeps those, a lot of the questions are already answered for them. Right. But if they have anything else, they can come to you. They can text you. They can email you. We do have a lot of different avenues to where, they can contact us.
Yeah. I think definitely people need to have that time to process in their alone time or their off time, and just like look over things. So however you can communicate that information to clients is important. So whether it's through, I will send you this email after, or it'll be a text. So I think the two-way texting thing is something that is really beneficial. Also, I imagine people would be, our vet friends would be kind of scared to take that on. They're like, I don't want more texts. I don't want to text my clients. I already get phone calls. So I know you had mentioned you use it for, quick blood work results, especially if it's normal.
Yeah.
If you're doing like an anesthesia procedure, you could say like everything's going well, just like touch base. That
Spay went well.
Yes.
Fluffy's waking up from
we'll
surgery.
Call you after, whatever. And then it not only gives the pet owner like this like sense of relief, like, my dog just went through his dental and had 14 teeth removed, and it was like, I know what the procedure is, and I was freaking out.
Yeah.
And so they texted me during it, and I was like, oh, okay.
And I think that's sometimes as vets and practice owners and vet techs, anyone that's in the industry, we do get blinders to where we're just like, why are they so worried? Or why are they calling every 2 hours to check on their pet?
We do it all day long.
Because we do it all day long, and it's hard for us to go back to like, oh, now we're the client. And I think we need some of those instances where we are. My Basset Hound has now a grade 6 out of 6 heart murmur. So I'm like trying not to freak out. But the best part about doing any type of workup for him is it reminds me how clients are feeling. And so I try to use those interactions or feelings that I have to better understand how my clients are feeling and know this is what I would want if I were the client. I would want my doctor to talk to me about XYZ.
Right. Yeah. And to do that in, now we can do it in more efficient ways. So, so that all of those kind of tools, incorporating them makes that engagement with your clients even more like robust and like connected. Like your clients will feel more loyal to you. They're like, my doctor takes care of me and my pet.
They're connected to you.
Yeah. And I think that's pretty special.
Absolutely. And it can help free up your licensed vet techs, your assistants, even some of your reception to not be on the phone, not be, having to run around so much, doing things that maybe they don't necessarily need to be doing. They need to instead be, doing blood work or placing a catheter, and which I feel like is a great segue into utilizing our techs to, work and grow faster and stronger and better. Yeah.
And I think incorporating, now that we have more tools available to us, like incorporating that into the everyday really does allow for the freeing up of the support staff to be able to be doing the things that they love doing and developing, to your point. Like, I think I just remember like a lot of my team members wanting to have, I want to learn these skills. And we had like a list of like training skills that we like bring people through, and it allows them to do that if they're not being, pulled into doing sort of the,
administrative
type,
yeah,
that kind of things. Yeah. So I think it's so important to, be looking into those different avenues that are available now.
Yeah, absolutely. So when you were in practice, would you did you have any two-way texting, emailing, like things like that?
I'm going to kind of date myself a little bit because I've been in industry for the last 10 years. But we didn't have that at the time. Yeah. And so that's why I feel like I can speak to that. But we talk with veterinarians all the time because we take in people's opinions, and we want to hear the voices of vets. So we really try to hear what the concerns are. But I would think, I just remember not having that. So when I learn about these new technologies and incorporating that, how that would make such a huge difference in my day. Yeah. If I had that. The thing that really hits home for me is the staying till 10 o'clock doing this. Yeah. That was a real thing every day. Yeah. And it's not okay. We can do better. Yeah,
absolutely. And I think, like you said, with connecting to your clients and them feeling like they matter to us, because they do. We all know that they do. Right. But sometimes that may not come across because maybe they aren't getting to talk to. I know that, I have my own doctors, and, you kind of feel like, well, they don't know me. They just see me when I'm sick or whatever, and there's not really that relationship there. Whereas I feel like I have a relationship with the majority of my clients. I've had clients become best friends. I mean, you get this, I think that human pediatricians are very similar to us because, you take your kids so often, and they do such a good job as well at getting connected. And if your kid's sick, you usually can call and maybe talk to the nurse. And then if the doctor needs, I've had our pediatrician call. I mean, it's great. And those things matter when you're worried about your kid or your pet. Right. Being able to talk to someone or stay connected, and them knowing that they are still involved in your pet's care, really, I think, really goes far and sets us apart from other professional, medical professionals, that while there is maybe a little bit more scrutiny that we, are challenged with, we do make ourselves pretty available to, let them know that we care.
Yeah, I agree. Well, let's talk a little bit about how to integrate these tools into the practice, because I think, like we mentioned before, it might be a little daunting for people to, take that first step and think, oh, I don't have time for it. But it's like, how can you not have time for it? Like you have to make time for it, because
you have to make time.
It'll save you time in the long run.
It's a big step. You just have to kind of bite the bullet and do it. I know for me, content creation was a thing I got into from having fun, and it's definitely not a job now, but it's a big part of my career, and it helps to, promote my clinic and then just me personally. And that's something that I think people should also look into doing is, yes, people will get online and do websites, but people also want to see those TikToks. They want to see those Instagram videos of all the puppies and the kittens, and they want that personality, and again, help with client connection and communication that way. I've had clients from other practices come to me after seeing my video and be like, hey, can you do this surgery on my dog? I'm like, yeah, let's schedule you an appointment. Yeah. And then getting new assistants and techs and things like that. You're getting exposure, so you're having that increased availability, as a practice. Increased awareness.
It goes back to that branding and all of the different touch points in your practice that you can bring your clinic's branding, your personal branding. I think that's really key.
And there's a lot of different options out there for, content creation. Obviously, you can do that as a practice. You can do that as an individual. You got to make sure that your practice is okay with it if you're doing it with an individual. And then with the other avenues that we've talked about with two-way texting, appointment scheduling, AI scribes, there's so many different options out there. I know MWI has like its own platform. There's other companies as well. This is, whenever you go to your required CE events and go to these conferences, there's usually a huge exhibit hall. And this is where you can find those different avenues, the two-way texting, the, talking with different brands about, why do I need this for my practice, and getting more in-depth conversations with those. So definitely for our listeners, check those out, because even though it can be scary, it can be a big leap of faith. Sometimes it can really help set your practice apart and make your life easier.
That's huge. And at those conferences, I think more and more talks are being done around that too. So look for, if you are going to those conferences, look for talks that are around technologies and how easy that is to incorporate into your practice. I would recommend also looking for platforms that have sort of a suite of products that work well together and are easy to implement. And go talk to reps there, go to the booths, go to the talks. I think there's a lot of CE out there too on technology.
Absolutely. And usually at the booths too, they have like really fun games and cool swag.
Don't forget those. Love it.
Oh, well, I think that's everything for today.
Again, love this topic. We talked about what it takes to kind of brand your practice and transform your practice into a more engaging, a more inviting place for your clients, for new talent coming in, and really making your practice efficient. Thank you for joining us on this episode of The Vet Reset. We hope you enjoyed our conversation today about the many ways to transform your practice to be more engaging and inviting to your clients, and leveraging technology to maximize your clinic's efficiency and keeping your online presence, present. If this resonated with you, please consider subscribing and following us on socials. We appreciate your feedback, so feel free to leave us a rating and a comment. And don't forget to share this episode with your other veterinary friends who are eager to learn and grow. And remember, if you want to transform your practice, big or small, it is never too late to hit the reset button.